So you may be one of the millions of people suffering from inflammatory bowel disease or IBD. You could be wondering, hey, is this genetic or will I pass this on to my kids? Well, in this video today, we'll talk about exactly what is IBD, what are some symptoms from IBD, what are some treatment options in general for patients who have inflammatory bowel disease, what can trigger inflammatory bowel disease, what role does genes play in developing IBD, can it be passed down to your children, and at the very end of the video, I'll discuss how you can determine if you have inflammatory bowel disease. Guys, let's talk about it. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your health. Hey, if you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter where you can get great poop tips every single week. Guys, what is better than that? Inflammatory bowel disease or IBD is a very common problem that a lot of people have. This is very different from another condition called IBS or irritable bowel syndrome, but that one letter makes a huge difference in terms of what it is, what your symptoms are, and what it can lead to. So inflammatory bowel disease or IBD is an inflammatory reaction of your GI tract in which your body attacks your GI tract to cause inflammation, ulceration, fevers, nausea, pain, upset stomach, bleeding, really a whole bunch of systemic issues that are going on because of the autoimmune response that occurs when your body attacks the GI tract. Now there's two main types of inflammatory bowel disease. There's ulcerative colitis, and then there's Crohn's disease. I have a link to a video right here which talks about that in detail, what those differences may be. So the symptomatology can present in multiple different ways, but commonly for ulcerative colitis, it'll present as bloody diarrhea. This is why anybody who has any type of rectal bleeding, no matter what you think it is, we need to do a colonoscopy to find out exactly what is going on to make sure you don't have ulcerative colitis. Crohn's disease typically presents as very massive watery diarrhea. This is diarrhea that causes weight loss, wakes you up in the middle of the night, very difficult to treat. And the only way for us to know if you have this, once again, is for us to take a look to see exactly what's going on. But both diseases can cause other symptoms like joint pain, fatigue, abdominal pain, fevers, feeling like you're inflamed all the time, skin lesions, eye lesions, and all sorts of other non-GI manifestations. Now, there are a couple of different theories why people may develop inflammatory bowel disease. One of them is certainly the environment. Now, we are seeing more and more people developing inflammatory bowel disease than ever in the past. We also know that coming into a Western type diet or a Western environment does increase your risk for developing inflammatory bowel disease. What role the environment plays, we don't exactly know. Could be an exposure to some sort of element in this environment. Maybe it could be other things that we are exposed to. We don't quite know exactly what the cause is for inflammatory bowel disease when it comes to the environment. We also know there's an autoimmune response. There's something that triggers your body to all of a sudden want to attack the GI tract to cause inflammation, ulceration, scarring, narrowing, and all the symptoms from inflammatory bowel disease. What that trigger is, we don't exactly know what that could be. We know that in some people, bacteria could be playing a role. And this is very fascinating research. We're seeing a lot more patients who have inflammatory bowel disease have an abnormal growth of certain bacteria that we think could be a predisposing factor to develop this inflammatory condition. And then lastly, let's talk about genetics. So we know that genes play a significant role when it comes to having a risk factor for IBD and also to cause IBD to get worse in some individuals. What that role is, we're not 100% sure. Here's what we know though. We know that ulcerative colitis, for example, tends to cluster in families. We also know those clusters of families that have ulcerative colitis tend to get that disease earlier and tend to be more severe as well. We also know there's a role in genetics when it comes to ethnicity. Caucasians or Ashkenazi Jewish people, Jews from European descent, tend to have a higher predominance of inflammatory bowel disease than people who are not from that area. And we know that some of the genes that are linked to colitis or Crohn's disease is related to the ability to produce protective proteins or to not develop those proteins. So normally these protective proteins maintain a level of barriers from outside bacteria to infiltrate the GI tract. When you lose those barriers, that causes that inflammation to occur inside the gut to cause worsening inflammation over time that can lead to symptoms and manifestations of inflammatory bowel disease. We also know that certain genetic makeups in people who have inflammatory bowel disease have an impaired immune system, meaning it makes it more difficult for them to fight off certain infections on the cellular level. So that can cause your immunity to accidentally attack the normal bacteria inside the GI tract, thinking this is a bad guy when actually this is really part of your normal gut microbiome. But that attack will cause inflammation and narrowing and ulcers and all sorts of GI issues to occur. And we know there's more than 70 susceptible genes that are linked to inflammatory bowel disease. And a problem with any one of these genes can lead to a cascading effect of GI issues with IBD. Hey, I hope you guys are enjoying this video. I really would appreciate it if you smash that like button and comment it down below. So let's answer a couple specific questions about genetics when it comes to inflammatory bowel disease. Number one, does the risk of having IBD change depending on the type of family member that is affected? And the answer is yes. We know that there is a higher risk for a first-degree relative for somebody who has inflammatory bowel disease than a second-degree or a third-degree relative. So for example, if I have inflammatory bowel disease, there's a higher risk that my brother or sisters may have that disease as well. Now the highest for sure is if both mom and dad has inflammatory bowel disease. If that happens, there's about a 33% chance or 1 in 3 chance that their child will have either Crohn's or ulcerative colitis. So what happens if there's multiple family members who have IBD? How does that change the risk? Well, we know if there's more than 2 family members affected with IBD, especially if they're first-degree relatives, this will substantially increase your risk for developing this disease as well. So I want you to think of it in this way. Let's say there's about 10,000 people in a given population. Out of that population, there is a chance that 2 of those individuals will develop inflammatory bowel disease. Now, if you factor in family history, that number of affected individuals will multiply at least 48 times of a higher risk. So can you do anything if you have IBD to help protect your child from not getting it? Unfortunately, we don't have a good answer for this. We don't know exactly what role genes plays in terms of developing IBD, nor do we know which genes are passed on down to your offspring to make them at a higher risk for developing this condition. It's possible that there are other shared risk factors like a common microbiome, common environment, common food, maybe playing a role as well. We just don't know. Now, as a parent myself, I know you want to protect your child as much as you can from developing a disease, but so far we don't have any known things that we can do to minimize that risk. So lastly, let's talk about treatment. So in general, there is a role when it comes to diet and lifestyle changes to help control inflammatory bowel disease. Here's the way I think of it. When you have active inflammation, we need modern Western medicine to help decrease that inflammation and keep things at bay and to decrease the fire that's there. Now, once that fire is gone, then we can use diet and lifestyle to maintain the inflammation, to keep it at bay. And there may be a point in time when we can actually take you off of the medication and hopefully continue with the treatment with diet and lifestyle. Now, there are a lot of medications that we can use for inflammatory bowel disease. I have a video on here linking to them. But in essence, what we're trying to do is we're trying to help suppress the inflammation and keep things at bay. It's like having a forest fire going crazy. You need to get the big hoses and the big guns to help minimize that inflammation. Now, once that's done, diet and lifestyle plays a significant role in making sure the inflammation does not get any worse and to keep the inflammation in the forest fire down. Things that you can do: number one, you have to get good sleep. There's so much good evidence that lack of sleep or poor sleep will increase your risk for inflammation, increase your risk for having a flare, and can make it more difficult to control your IBD. Number two, diet plays a significant role. Out of all the diets that you can do to help improve the inflammation, guess what the best diet is? Come on, you know it. A plant-based diet. Yes, a diet that has a lot of diverse plants is going to be the best thing to help decrease the bad bacteria, increase the good guys, and by doing that, change the balance of your gut bacteria and microbiome to make it better for your gut and better for your ulcerative colitis. Sometimes adding things like turmeric or curcumin can really help out with what's going on as well. There is some evidence that this can actually help decrease inflammation in individuals who have mild ulcerative colitis. So you may be wondering, all right, I'm watching this video and now I'm freaked out. Oh my goodness, do I have Crohn's or colitis? What can I do to get checked out? Here are my tips. Number one, see a GI doctor. This is what we do. This is what we specialize in. This is my bread and butter. We are experts in this. Don't try to go to anyone else because I'm sorry, they don't have the education or the tools to help diagnose somebody with inflammatory bowel disease. Now, if I see somebody who has this condition, here are some of the things I'm going to do. Number one, I'm going to get some blood work. Sometimes we can see evidence of inflammation based on the blood work. You may be anemic or your blood count may be low. Your albumin or protein may be low as well. You may have stool evidence of inflammation that's going on inside your GI tract, and you can have blood levels evidence of inflammation as well. Things like a CRP or an ESR. And we can also check these stool markers like stool calprotectin or stool lactoferrin. These are inflammatory markers that we can use to help indirectly see what's going on. But the best test by far is to take a look with the scope, both an upper endoscopy and a colonoscopy, to see exactly what's going on. We can see with our eyes the amount of inflammation, how bad it is, the extent of it. Is there something that needs surgical treatment? What medical options can we provide? I need this information to help allow us to have the best options for your treatment, for your disease, to see what's going on, and to also determine what the next steps are going to be. Now, in addition, we may do imaging like a CAT scan or an MRI to see areas outside the body that we cannot see with the scope. And there may be other tests we can add on there. But by and large, the best test for us to see what's going on and hopefully find out what we can do is to take a look with the scope. So I hope this video was helpful for you. If you're wondering about the role of genetics, my question today for you, what questions do you have about IBD? What questions do you have about genes, treatment options, triggers? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter where you can get great tips and tricks like you're learning in this video. Guys, I hope you have a happy and healthy day. Take care. And don't forget, let's talk about poop. Hey, listen, if you want to learn more about inflammatory bowel disease, I have a playlist right here which I think you would enjoy.